Breast implants versus fat transfer, which is better? So it depends on your goals. The advantage of breast implants is that they create a very predictable change in volume. If we put 400 cc implants in your body, you are adding 400 cc's of volume to each breast. It's very predictable. We know the change that we are creating. Breast implants can also help create a shape, meaning they have inherent structure. The implants themselves can help create a round, more youthful breast shape. Fat, on the other hand, is less predictable when it comes to how much volume you will be left with. If I add 400 cc's of fat to your breast, my guess is that around 200 to 250 cc's of that fat will survive. So there is uncertainty regarding the percentage of fat that will survive transfer and what your final added volume will be with fat transfer. That is the major downside to fat grafting. The other thing is fat grafting doesn't add shape. If you want to create a lot of upper pole fullness for that convex augmented look, fat will not do that. Fat doesn't really have a whole lot of structure compared to an implant. The advantage of fat grafting is that you don't have to have implants, meaning you don't have to put implants in your body to increase the volume of your breasts. The other advantage of fat is that I can inject it anywhere. I can inject it in places where implants can't go. So if you want a lot more cleavage, implants can only be put so close together on your chest before you can have a complication called symastia. Fat grafting doesn't cause symastia, meaning I can add extra fat along your medial breast area to increase your cleavage without worrying about symastia. So that is one advantage of fat. The other thing, I can add fat higher up on the tail of the breast where the implants don't go to increase the upper pole fullness in this area. So pros of fat grafting: it's your own fat, not an implant. We can put it anywhere. The downsides to fat grafting are that it's the amount that lives and survives is somewhat less predictable, and it doesn't create the same shape or force a shape like an implant can. Advantages of implants: very predictable. We know what we're getting, and it can kind of help create a shape or a roundness if that's what you're looking for. Finally, one of my favorite operations is doing both. So what works great in most women is to do a breast augmentation using implants, and the implants do most of the work. They create most of the change, and they also create the shape that we want to create. And then we can use fat grafting as an adjunct to add volume around the implant where the implant doesn't go. So once the implants are in place, I can inject a little bit of fat along the medial side of each breast to improve the cleavage, as well as the upper poles to help fill in that transition point between your native chest wall where there is no implant and your chest wall where there is implant. So fat grafting can be a great adjunct to kind of fill in volume around the implant to create a more natural look. The other advantage of doing both fat grafting and implant placement at the same time is that you usually need a smaller implant, meaning if we're going to inject fat, that's going to add some volume in the areas where you need it, where the implant doesn't go. You might not need as large of an implant to achieve your final goals. And the smaller implant you can have that achieves your goals, the better, because your breasts will not age as fast. In other words, it is safer for you to have fat grafting and a 400 cc implant than it is to have no fat grafting and a 600 cc implant. In other words, your tissues will undergo less stress over time with a 400 cc implant compared to a 600 cc implant. So keep that in mind. Fat grafting can add volume to the breasts, implants can add volume to the breasts, and both of them working together can create even better outcomes. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.